Claustrophobia, Part 3. There is a very famous inquiry, everyone asking the other, can someone recover from claustrophobia? Is there anyone who has recovered from claustrophobia? This fear troubles the patient a lot, especially when going to a new place. If an incident can happen in this condition and the person gets trapped somewhere, like in a jail or in a bathroom, how can they survive? Is it just a fear which turns into an anxiety, or it can be a real threat to the life? There are certain patterns which trigger the disease. Well, it can be genetic as well. Some of the people whose parents had suffered from the same anxiety, same psychological disorder, same disease, their children are quite likely to suffer the same. Sometimes they don't suffer it in their childhood or boyhood or girlhood. Who knows? Such a phobia may develop with the aging as well. Those who were pretty fine in their childhood and boyhood or girlhood do become a patient of claustrophobia either in their middle age or in their old age. Those who had frequently traveled by aeroplanes now can't travel by aeroplanes any further. Those who have used very narrow streets to pass through now cannot engage themselves in such a journey. Those who used to travel a lot in crowded bus can't endure it any longer. So the aging is also one of the concern. The older a person gets, the stronger this phobia can get. Yes, there is genetic justification as well. When we talk about Pakistan, there are very few patients of claustrophobia, and it is not that very much common. I have seen a tendency of claustrophobia in the obese patients, those who are fat, obese, overweight, may develop such a phobia. Talk about the same person when 10 years ago, or 20 years ago, or 30 years ago, they were pretty smart, light-weighted, they face no such problems. So, as I've just said, that claustrophobia develops with aging, should I say, claustrophobia develops with gaining more weight. The patients who were in their youth light-weighted and today either in their middle age or in their old age when they have become fat, overweight, have developed claustrophobia. So there is a role of aging and getting obese when we find claustrophobia. Claustrophobia basically is a phobia, it's an anxiety. In reality, there is no danger, but the patient believes that there is a danger. I'm not in favor of those pills, the medication, but I believe since it's a phobia, it should be dealt with the psychological development. Yes, there are persons who have overtaken their phobias, and you can find a number of people who were the victims of claustrophobia, but now they are living quite comfortable lives because they have controlled their phobia, overcome their anxiety. That's all for the day. Talk to you next day.